How has the use of electronic health information helped lower overall healthcare costs?
So we talked a little bit before about, just kind of that aggregation of information, and we're starting to get there. And the chart chasing, as we like to call it, that Laura talked about, where, we have information on a claim, but we really don't know what the value of that lab test really was, and people have to actually go out and get that information. By having that consumed earlier in the process, we're able to attack that issue and lower the cost as a result of that. Maybe not have another lab test required by the next physician in the progression of that patient's journey. Do it once rather than multiple times, things like that. Having that data available is a clear way to lower costs. I think in general too, when we look at, we have something we call bundling, where you're looking at an episode, an event where you've got multiple physicians for something like a hip and knee replacement. That bundle, having an incentive there to create a budget and have a physician or a specialist responsible for that budget, that'll help drive down costs as well and also improve outcomes. So the right procedure, the right protocol for that patient based on that individual's needs. A couple of different things that I think help lower costs overall.
Great. Jim?
Yeah, I agree. I think the best example to date is in utilization. I think what we do well now is share things like lab results, radiology results, not necessarily images, but at least dictated results, so that providers do have access, whether they're in a large system or working through an HIE, and 60+% of hospitals are contributing to HIEs right now in New Jersey. So they are getting information about tests that don't have to be duplicated and repeated. And I think if we roll the clock back to 10 years ago, we see that that's much better today. I think we're on the 15-yard line and have 85 yards to go. But we've probably made 15 yards in the past 5 years, where in the last 25 years we've only made 1 yard. Things are getting better in terms of the need and the ability to better use health information to avoid not only tests, but to keep patients healthier. And the example of preventive tests is a great one. If you can keep people on schedule and make sure that they get their tests done to get early detection, that tends to drive down costs significantly if you can treat a symptom before it becomes a full-blown problem. Then that's where a lot of the promise of savings are going to come from.
Great, thank you, Jim. And Laura, we have just a couple of minutes before we go to the audience for questions, so can you share us your thoughts?
Well, I think that I appreciate the comments from Jim and from Doug. I think that the criticality of what you're faced with is creating a connected healthcare system. And you're not going to be able to really reduce the costs until you connect your doctors, your hospitals, your pharmacies, and all of your other providers together and be able to share information. I'll give you an example that I think is really relevant to you here, which is around the opioid crisis. So in Kansas, where we have 126 of our 128 hospitals connected together and sharing data, and 70% of our physician practices and all of our labs, LabCorp and Quest, all sharing data. We have a pretty good view of what's happening with our patients around the opioid crisis. Unfortunately, for states that don't have that level of connectivity, they don't have that. So we have a three-pronged approach that we take to try to reduce the opioid problems in our state. First of all, we have a connected health information exchange. So a patient who is med-seeking, who goes to the first emergency room, and we know this happens. They go to the first emergency room, they get a prescription for pain meds. They go to the second emergency room and get a prescription for pain meds. They go to the third emergency room and get a prescription for pain meds. The emergency rooms in many of these states that we work in are not talking to each other. But in Kansas, you can actually look at the information in the health information exchange, and you know that the patient was in the emergency room down the street 30 minutes ago. You've got to have real-time clinical data to know that the patient has been in 3 emergency rooms in the last, 5 hours. The other part of that is, so you've got your health information exchange. That helps to make sure that everybody knows, don't write another prescription for pain meds, because she's already got 3, right? She's already got 3 prescriptions for pain meds. Then the second thing that happens is that we've got prescription drug monitoring programs. We've had that in place in Kansas since 2010. We were one of the first states. Our patients learned to scam it right away, because basically they went and they got all the prescriptions from the hospital emergency rooms, they held them, until, a couple of days later, and they went and filled them all within 3 hours at a wide variety of pharmacies. And so there's no time for the data to get from the pharmacist to the prescription drug monitoring program back down into the portal for the doctors and the hospitals to be able to see it. So for those particular situations, you have to have a health information exchange available, or you won't be able to actually know that the patient has just gotten 4 prescriptions filled for pain meds in the last 2 hours at different pharmacies. And so then lastly then, we really have put a focus with our employers on making sure that they're working with the payers to get information about the numbers of prescriptions that have been written for controlled substances. This is a group of us all having to work together to solve these crises. And I can tell you, we don't just think about that problem. We think about children's suicide. So we have an assessment now for children. If you have a child that has a major depressive disorder and they haven't had a suicide assessment in the last 12 months, we're going to push that information out to the primary care doctor and say, we've got a serious problem here with suicides with our kids. Let's solve these problems with data, because we've got the data and we can do it. We just have to work together.